I moved to New Mexico for college, and I ended up getting addicted to heroin while I was living out there. I moved home, was clean for about 6 months, and I ended up getting back on the heroin, and I stayed on it for about 8 years. I became pregnant with her. I was scared to go to a doctor because I didn't want to tell them about my addiction and have my child taken away. I was at a point where I couldn't even stop for my child. I couldn't stop for myself or my child.
Maternal deaths are never events. They should never happen. And when we know that substance use disorder is the leading cause, that is a call to action.
Hi, I'm Senator Beth Mizell. I represent the parishes of St. Tammany, Tangipahoa, and Washington. Today, I want to give thanks for the Hospital of Our Lady of Angels and the nurses and the doctors for their care of Rachel Hernandez and her little daughter, Raedynn. In the video you're about to see, they share the story of Raedynn's birth and the recovery of Rachel from opioid addiction, and it was done beautifully through our Rise Up program at Our Lady of Angels. I think you'll enjoy the story.
On November 10th of 2020, I ended up getting arrested, which turns out to be one of the greatest things that could have ever happened for me. I was incarcerated at St. Tammany Parish Jail, and they brought me here to Our Lady of the Angels Hospital.
She presented to us at 4 months. She was one of our incarcerated patients that we have the opportunity to treat here at our clinic. She first met Dr. Shaw after she was identified as an opioid use disorder patient. He was able to start her own treatment.
We actually want the mom to get on what's called medication assisted treatment, where she is on what's either Subutex, but that's the one we use, buprenorphine is the medical term. So basically they are prescribed a legal form of opioid that works in the brain the same way. The mom is on that throughout the pregnancy.
We do know that babies that are born with Subutex do a lot better as opposed to those that are on more harder opioids such as heroin and pain pills and things of that sort. And so we always try to transition them to the lowest dose necessary without having the moms go through any form of withdrawal too, because we do know that quitting cold turkey and going through withdrawals from the mother is even worse for the baby than being on the Subutex itself.
She was able to go back to the jail and take the medication. 4 months later, she was able to be discharged from the jail.
I ended up going into labor, came here, had a very smooth delivery. She was born healthy. She did have to stay in detox though. We stayed here for about a week.
Because the baby was exposed to opioids throughout the pregnancy, the baby also has an addiction, a brain chemical addiction to those opioids. And so when the baby is born, we know and we expect the baby will have withdrawal. We don't think of it as much as baby's withdrawing, I have to start morphine. We now think of it as, is the baby, it's called eat, sleep, console. Is the baby eating enough? Is the baby sleeping at least an hour? Is the baby consolable? The outcomes that I feel like are the best is when these moms get in our program early, stay in the program during pregnancy, then we follow the baby in the pediatric clinic, and we see these kids grow up healthy just like any other kid. Their brain forgets the addiction. It doesn't affect them anymore because we were intervening early.
Everything we do is driven by our mission to serve all of God's people, especially those in most need. The collaborative care model is literally changing the trajectory of the lives of so many moms and babies in our community.
I did stay on the Subutex for a while, and then I ended up going to rehab, and now I'm currently 100% drug and alcohol free.
Our goal is to kind of get the patient as comfortable as possible, but when we see success stories like this, we know that it's possible that we can get patients off of it completely too.
We're so tremendously proud of these moms that are being so brave and coming through our program. I'm so proud of them for stepping up and being a beacon of hope for others in our community that may be plagued with the same problem.
Ms. Patsy asked me to be on the Patient Advisory Council for Our Lady of the Angels. I want to eventually be a peer support counselor. I want to work with other women who are in my situation. This needs to be heard. Women need help that are in this situation, and to be a part of a program like this, you will feel truly blessed.
I want to applaud Our Lady of Angels Hospital, their doctors and nurses for their innovative work in the creation of the Rise Up program, which allowed for the recovery of Rachel and the birth of her beautiful child, Raedynn. Thank you.